Hello everyone. Welcome to YouTube channel HealthQ, where our mission is to not only motivate you but help you to move on to the brighter side of the health. And that's why we bring on a lot of informative videos for you, lot of content. And recently we have started organizing webinars where we bring guest doctors with us who are expert in different domains of physiotherapy rehabilitation, on medical management side, on alternative healing side, all at one place so that your health problems can be resolved and you can look and move on to the brighter side of the health. So today, I am very pleased to have on board with me Dr. Dipal Shah. She is an onco rehab physiotherapist who is running her clinical practice in Ahmedabad. Along with that, she is also associated with HealthQ Rehab as an onco rehab physiotherapist and on a tele rehab basis. She has got immense experience in onco rehab space, and she has helped more than 100 patients suffering from cancer related issues that comes post cancer complication, or else the movement related issues that patient experiences during the time or process of cancer recovery. Welcome, Dr. Deepal. Thank you so much for joining today's session. Before we start, I would quickly want you to introduce yourself furthermore to people. Give a small intro about you and also how you started your journey as an onco rehab physiotherapist.
Sure. Thank you, Dr. Meghna, for the introduction part. Basically, I have done masters myself, Dr. Dipal Shah, and I have done masters in cardiopulmonary conditions. And I'm practicing in this field since now more than 18 years, around 18 years. So basically, I have worked in all the specialities like physiotherapy in musculoskeletal conditions, neurological conditions, but my specialty is in cardiopulmonary conditions. And since then, I was treating cancer patients on and off. But later on, again, I did this course on cancer rehabilitation so that I can exclusively treat these patients. I can understand their problems and what complications they go through when they are in their cancer journey. So since then, around like for now, around for more than 2 years actually, I'm practicing with onco rehabilitation in like specialty wise. So I treat all the patients, and main my focus now on nowadays is on cancer rehabilitation.
Right.
So I
So,
do.
yeah, please carry on. I'm so sorry
Yeah.
to.
No, that's okay. Tell me.
No. I just wanted to ask you a follow up. Like, what made you so interested in cancer rehab? What you find the most interesting part about it?
See, the most interesting part, I would say, nowadays the cancer and prevalence of cancer has increased rapidly all over the world. So, cancer is heard like on everyday basis. We come across like some or the other our relative or friend or any known person is either suffering from cancer or going under the treatment for the same. So physiotherapy, people are very well aware about role of physiotherapy in treating generalized other conditions like neck pain, back pain, and all the other related issue, or the stroke hair, facial palsy hair, and all that. So that is what took my interest. Ki there is very little awareness about this very common nowadays, very prevalent area of health, which affects the quality of life and in fact affect the whole family during the treatment part. So it needs the attention basically, and also awareness. Till now there is a little bit of awareness about what is the role of physiotherapy in cancer. So that is what kept me interested in this cancer rehab.
Wow, that's amazing. I would like to take a little step further and let people who are listening this term cancer rehab for the first time understand what exactly cancer rehab is all about.
Yeah, sure. So, as any rehabilitation, we can say cancer rehabilitation is also a set of interventions or therapies which are provided to cancer patients to optimize their function levels and to improve their quality of life, basically. Because what happens in the cancer, mostly major treatment part is done by the specialist, like if it is radiation therapy, chemotherapy, or the surgery part, whatever is required is done. Then after during the treatment or after the treatment, because of the treatment, like if radiation is given or chemotherapy given or the surgery is done, then there are many kind of secondary complications which affect the quality of life of the patient. So, what happens basically nowadays, because of the advanced technology options and awareness and early screening and detection, cancer is detected at very early stage. It is not like previous era where it was detected on the last stage only, and there were very few treatment options were available. So people were left with very minimum options for the treatment, right? So nowadays with early screening and cancer is happening, we can see in young people also. It is not an age related issue where you get after 50 or 60 only you get cancer. Nowadays we see patients in 20s and 30s also, they are suffering from cancer. Even children also are getting this serious condition early in their life. So, but with treatment part, the what we can say, the duration for which the life expectations has increased. It is not like if you are diagnosed with cancer you are going to die soon. Now it is not there. We have so many treatment options, and affordable treatment is available. Also, very advanced treatment is available. So patients are very well managed all over the world. But the problem is main treatment part is done, then life, the quality of life is affected basically. So what does rehabilitation does is, rehabilitation is a teamwork. So where a physiotherapist, occupational therapist, clinical psychologist, nutritionist, yoga instructor, all those paramedical persons come into picture. They help you identify your limitations and what is hampering your functional capacity, like at physical level, and also it affects the psychosocial status, because psychologically also patient needs counseling and all those things. Their diet pattern changes, so nutritionist is required. And so it is a teamwork basically. And as soon as cancer is detected, all of them come into picture actually. So to prevent secondary complications from hampering patients' quality of life, we need to introduce cancer rehabilitation as early as possible.
Right. So, are there any particular kind of cancers where physiotherapy play a very prominent role, or it applies to all?
Basically, it applies to all. Physiotherapy, physical therapy helps patients to be as active and as independent as possible. There are some misconceptions that patients are too weak to exercise and they will get tired, and all those misunderstandings are there. But physical therapy helps as early as possible. It should be introduced in the rehabilitation part, and cancer care team has to have a physiotherapist on their treatment team actually.
Right.
And most common cancers where physiotherapy plays very important role is like if breast cancer, then all the head and neck cancers, even gynecological cancers. These cancers give secondary complications which affects the quality of life and functional independence. So there are secondary complications can be very well managed with physiotherapy.
All right. So let's say when you mentioned that, that head and neck cancers, most of the head and neck cancers have a very important role to play from a physiotherapy standpoint. What are the common complications that can be managed with the help of physiotherapy in head and neck cancers?
See, in head and neck cancers, maybe mouth cancer, tongue cancer, or jaw bone cancer, all these cancers require plastic surgery also, because after removal of the part, cancerous part, flap is taken from any of your body part, either from the arm or the leg, and surgery is done. So after that healing part has taken care of by surgeon, what happens is there is a very limited mouth opening because of the change in the structure also, and the flap plastic surgery also. They are not able to open their mouth. Then teeth are removed from one side. Then they are not able to chew on the other side because they are not able to even open their mouth. So initially they have to survive through liquid diet or semi-solid. But gradually, if physiotherapy is not done, it becomes a permanent secondary complication of their treatment, because they have survived cancer, but they are not able to eat properly throughout their life. So what physiotherapy does is physiotherapy there are a set of personalized exercises which are given to them, stepwise exercises, which helps them to gradually increase the mobility of their mouth and chew better, and so that it does not hamper their health and nutrition part.
Right.
And it is very frustrating actually, when patients are done with the surgery and they come with this problem that we are not able to open our mouth and eat
Right.
anything. It's a very frustrating and depressing situation. But with
Right.
proper physiotherapy plan, it is very well managed. If early physiotherapy is introduced, then they can
Mhm.
definitely get better.
Right. So I would like to add on one thing here. In my experience, we are seeing one case who suffered from a tumor around the temporal region, around the behind the ear, and when they were in the process of removal of their tumor, there was a damage to the facial nerve. Post which
Right.
there was a very long gap which was there for the patient, where the patient was completely immobilized. So what happened in along with facial paralysis, the patient also developed a very strong scar mark behind the neck, and now that scar has become so tight that it's not mobilizing, and that pulls
Well,
the entire area of the neck region. So patients, what I'm trying to tell you, or even Dr. Deepal is trying to make you understand, is despite any surgery you go through due to cancer, or due to any of the facial related cancer procedure you are also going through, there are going to be muscular imbalances, there are going to be muscular tightness, there are
tightness,
going to
and
be
also
other.
neck muscle tightness.
Yes.
In head and neck patients, this neck muscles become very tight. They are not
Right.
able to move their neck properly. Even shoulder stiffness comes into picture later on because of the
Exactly.
limited neck mobility. So all these issues can be addressed with only with the physiotherapy part.
Physiotherapy.
There is no medicine which can cure this stiffness or flexibility part.
Absolutely. And even the facial expressions also can be very well managed and improved with the help of facial exercises, if done at the
Yes,
right time from the right therapist.
exactly.
Moving from there, if we talk about breast cancer in particular, and lymphedema in particular, because that's also one very severe complication post mastectomy or any breast cancer removal surgery. How lymphedema impacts person's quality of life, and how physiotherapy helps a patient to overcome that.
Right. So we know nowadays we come across this breast cancer term so frequently. It has become very common. Even it's not like those who have family history, they only suffer through this condition. So many young females are suffering from this. Through early detection, breast is preserved, but other than that, complete removal of breast and complete radical mastectomy has to be done. So what happens is lymph nodes are also removed as a precautionary part. So when lymph nodes are removed, the lymphatic drainage that has to happen, it does not happen the way it should. So the fluid is collected in the arms and the affected arm. Like for left, if left mastectomy is done, then the left arm gets the swelling because of improper drainage of lymphatic fluid. So because of the collection of fluid, there is swelling of the arm. So whole arm is like swollen. It is painful. It reduces the movement of the arm. Patient may develop shoulder stiffness also, and they are not able to manage their daily functions also when they have to use their arm. So, what physiotherapy may lymphedema is very much manageable through physiotherapy. There is complete decongestive therapy, DCT therapy is available, in which there is proper assessment is done of this lymphedema. Then they are given lymphatic drainage massage manually. They are taught how to do it at home also, so that they can manually drain the fluid. Then they are given this lymphatic bandage, which can be applied at center at night also. So what it does is it gives continuous compression to the arm. So it drains the fluid back into the space where it should be. It helps the drainage of the fluid. So this compressive bandages is available, and also compression sleeves are there, which if used early in the treatment part, then it can very well prevent the progression of lymphedema. So like there are 4 stages of lymphedema. If in one or two, first or second stage, if we give all this treatment, then patient can lifelong manage this condition very easily.
Wow, that's really amazing. And I guess
And also,
there are
if a
many.
center there are compressive lymphapress machine is there, and IPC is there, which helps in this drainage. So daily for 30 or 40 minutes, if it is given initially, it gives very good relief from the swelling. So patient can do exercises better. Then definitely there are exercises which they have to carry on, and there are some precautions also they have to take care of them to prevent further damage and swelling.
Right. So there are so many patients who are not even aware that these are the ways with which this lymphedema can be managed. So that's the reason I guess social media helps so much. At least through this video, we hope that somebody will watch this video who's suffering or going through lymphedema and can understand that still there is a ray of hope, because lymphedema can really affect a quality of
It
life
affects
as
the
well.
quality of life.
Yeah,
It becomes painful and
correct.
heaviness is there. So it
Right.
becomes very difficult. And there are very simple ways to manage it. Just the
Right.
awareness part is lacking.
Right. So moving on to uterine cancers, or cancers that is very commonly seen in women, the second sort of cervical cancer or uterine cancer. What is the role of physiotherapy, or you can say what are the common complications that you see there, and how physiotherapy helps in that part?
See, in all of the cancer, one of the common complication or the what you can say, otherwise also even whatever treatment part is done, whether radiation is done, chemotherapy done, or surgery is done, what happens is because the patient's mobility is affected, they reduce their mobility because of fatigue, because of this cancer stigma also, and also the fear what treatment will be done. There are very uncertain about their life also. So what happens that you reduce their activities, they withdraw from activities from work, at least for as soon as cancer is detected. So their cardiopulmonary endurance starts reducing. So while carrying out daily activities which they were doing otherwise normally, they get very easily tired, and they get breathlessness problem. So they find it difficult to manage their daily task also. They become dependent gradually. So this is a very important point which should be addressed from the early part of cancer detection. As soon as cancer is detected, they should be given some of the breathing exercises and to maintain their cardiopulmonary endurance, so that during the treatment or after the treatment as a secondary complication, they don't find it very hazardous, sudden drop in their cardiopulmonary capacity. So at least they can maintain whatever level is there. So this is a very common fatigue. Cancer related fatigue is the 90% of the patients suffer from cancer related fatigue, irrespective of what treatment has been given. And exercise is the one of the most effective treatment, non pharmacological treatment for this cancer related fatigue. There is no other treatment for this fatigue. Patients with exercises only, they can overcome this fatigue. And there is no contraindication for physiotherapy, like if a patient feels that I'm too weak, I'm too fragile. Even doctors sometimes feel that how can I advise physiotherapy or exercise to this patient? They need rest. They need rest, but rest is not the solution. Ultimately, they have to get back to their normal, at least be independent as much as possible. So, at whatever stage the patient is, depending on his or her capacity or the earlier stage of physical health, we need to introduce some of the basic exercises like breathing exercises and aerobic exercises as early as possible. So again, coming back to your question, like for gynecological cancers, they also come with lower limb swelling, this lymphedema problem. Like in breast cancer, there is arm swelling, and in the gynecological cancers, there is leg swelling. So that as soon as they are standing for some period of time, their legs get heavy and the swelling comes. And when they lie down, the swelling reduces. So there is no proper drainage of the lymphatic fluid, and it results in lymphedema and pain, swelling, heaviness, which hampers their daily activities. So for that also, physiotherapy is again very much effective. There is set of exercises also, and this compressive bandage and sleeves which they can wear while standing. It very much helps in reducing the swelling and reduces the pain also.
Right. So, if a person, let's say, is going through the cancer treatment or cancer protocols, and physiotherapy is something which is advised to him, and as you said, doctors sometimes are not open to tell them that you are a patient is feeling fragile. Still, patient can reach out to a physiotherapist anytime and can
Yes, yes.
request for therapy.
Definitely, they can reach out. Just what I make sure I just communicate with their main treating oncologist or oncosurgeon. So there is a open communication between the. So it is a shared responsibility. So we involve the patient and we involve the physician also, so that if they have any doubt, like if patient is at any point of time during the treatment, we can be in a loop,
Right.
physiotherapist in the loop of the treatment, because even if the two patients are same or same treatment is given, every patient is different. Every patient come up with different set of problems, their capacity is different. And we make sure that patient is proactive in this treatment. They communicate about their problems, even if some of the treatment they are undergoing, like for physiotherapy, from physiotherapy point of view, if some therapy is not working for them or they are not comfortable, be open, just communicate what is going on, what they expect from us, so that we can deliver better.
Right.
Physiotherapist, patients come and just talk about for what happens in first session. I just listen to the patients. They are just talking about all their journey, what happened, how it happened, when it started, and they have so many doubts, fear, and still, even after treatment is done completely, then also every patient has so many questions and doubts that they cannot talk about it to their treating oncologist or oncosurgeon because
Right.
they are
That's
too
very true.
busy to listen to this all this secondary or their day-to-day functional life problems,
Yes. Right.
so basically physiotherapists provide a bridge, I think, between the
Right.
main treating doctor, which also becomes because they think patient comes with the secondary complications. Sometimes they report to them and they are helpless, they are not going to help in them. They may add some medicines, but it also has a limited role. So physiotherapists provide a bridge between these doctors and patients to become a communication channel also and help them overcome these secondary complications.
Right. That's so true. I guess sometimes patients need that channel to talk, which they don't find, and I
They
guess
don't,
physiotherapists are the best ones to do that.
they are hesitant to talk about it to their doctors actually. They
True.
cannot
True.
tell these problems. They feel like it's like not worth to ask these questions, they don't
Correct.
get open, they don't open up about it.
Correct, correct. So, can you share any of the story or any of the journey of the patient? You don't need to share the name of the patient or so, but how that patient kind of moved from the space of suffering to a space where he's living a very functional and good quality of life.
See, as I told you, mainly we get this lymphedema and head and neck patients. So nowadays, many young patients in 30, 40s, basically working men, are coming with this mouth cancers. So some of the very few patients at an early stage, as soon as healing has been taken care of, the surgeon send them for physiotherapy. So they start physiotherapy. Some of them are office workers. Um, so recently, one patient came and he was like, if you look at him, you won't even make out that surgery is done. It was done so nicely, the surgical part. Still, he was like, there is a the flap which has been taken from the arm. The mark is there, and so it is embarrassing for him. First of all, cosmetically. Otherwise, he is full functional. He had some neck and shoulder. He was into sports earlier. So because of the shoulder stiffness, he wanted to go back into sports. So we provided him all the rehabilitation, advanced physiotherapy treatment, and his mouth opening was not optimum. So for that also we did a good job. For there are mouth opening devices also, how to use them, how frequently you have to use them. So mouth opening is fine, but with this and also this again cosmetic जो tension है that तो with counseling only we can cure कि भाई life बच गई and you are worried about a small patch or scar on your arm, like right at right time you were treated with all the advanced treatment and look at your face, no one can even make out, but like slight 1% because you keep on looking at your face all the time, no one is otherwise going to notice. So what happens is some patients have all the recovery more than expected, then they are stuck at some minor issue which needs acceptance only. We cannot do fully 100%, but cancer patients are getting back to life very normally. He is working hours, very good family life, social life, everything is normal, and he went back into sports also.
Wow, that's amazing.
Not
That's
for
amazing.
like, but at least once in a week or twice in a week for with friends, sports to be badminton and everything he was playing is back to that and very much enjoying. So
Right.
without physiotherapy, it would not have been possible.
Correct. Correct. And I think that's the key thing that people need to understand, that physiotherapy is not a procedure, it's a process, right? Rehabilitation is a process where you on a very step by step incremental manner get back to your life which was impacted, or as you can say sometimes you become disabled also, right? Due to all this issue, so you are in a position where you are not able to move, you are in a ICU bed or maybe in a hospital bed. So the key concept or key idea is to make you as functional, as independent as possible, rather than focusing on curing certain parts, because that is something that is the job of a doctor
Definitely,
who's trying to
definitely.
do. So that is the key message that we always try to put in front of people, that they should understand that physiotherapy,
We cannot
rehabilitation,
add years to your life, but
correct,
we add the life or whatever
life to the
quality
years,
of life is
right,
missing, we can
right,
give back to them. Because
exactly,
physiotherapy, also, if even if you have any disability, what assistive device you can use, how to use them, how to optimize your energy and strength level. That is also very much important, which only
correct.
physiotherapist can guide you.
Guide you. Very true, very true. So, just a last question, like, what is a session or is the journey of a patient looks like, or what is the way you work with a patient when a patient comes to you? How it start? How the process starts?
See, basically, I'm trying to spread awareness that even before the treatment starts, like for patient is advised for radiation therapy or chemotherapy or surgery, before that, if physiotherapist can do at least one session, so they get a brief idea about their journey also, and what secondary complications he or she may have to suffer as a part of treatment, because these complications are secondary complications because of the treatment only. It is not related to cancer. It is the
Correct.
treatment part which is giving them this, like pain, swelling, reduced cardiopulmonary endurance, whatever is there, it is because of their treatment part. And to they have to undergo this treatment, and they are going to suffer from some of the secondary complications. So if one session is done prior to all this treatment, they are mentally and also physically better prepared for the outcome, so
Right.
it becomes very easy to manage later on, rather than suddenly after treatment they get this shock. Even after treatment, now I am finding all these problems. So physiotherapists play a very important role in prehab also, before the treatment part. Then during radiation and chemotherapy, they are going to suffer from weakness and all the other metabolic issues and all those things. So during that part, we try to, if physiotherapist can do at least once a week session, then what they make sure that they are as functional as possible. They prevent this fatigue, which happens, weakness, which happens because of the radiation and chemotherapy. So during radiation and chemotherapy, this part is very much important to maintain their cardiopulmonary and their independence. And if surgery is the treatment which is done or which is to be done, again, pre-surgery session is very much important. And after surgery, if there are the secondary complications, lymphedema hai or head and neck hai, तो after healing, this mouth opening, neck stiffness, shoulder stiffness, all these complications can be very well managed as early as possible. When the healing part or surgical part is done, we can start physiotherapy as early as possible.
So I guess there is one question from Abhishek Singh. Hi Abhishek. So let me read this out. So he's asking, please explain about hospice and palliative care.
So palliative care is like we all know, like when cancer has metastasized. So palliative care is given so that patients at least maintain their mobility, whatever duration of life they have. So it makes sure we provide comfort more than the treatment. How much patient can feel comfortable during this palliative time, so that it gives them comfort care and also reduce their caregiver task, because
Right.
if they are totally dependent on the caregivers or family members, it becomes difficult for them also. So palliative care is again very much needed.
Right. So, just for the context of the listeners over here, who would have heard this term palliative care at the first time and metastasis for the first time, so if you can just explain them what is metastasis or advanced stage cancer and what is palliative care, it would be easier for them to understand this better.
Yeah, sure. So, what happens is when the cancer is benign or is limited to one part of your body, like we talked about breast cancer or head and neck cancer or gynecological cancer, the treatment is done according to that part. But with advanced stage or relapse or recurrence, what happens is the cancer has spread through your body, like it goes to spine level, it goes to lungs, it reaches to the places where there is no single treatment which can cure it. So they are termed as palliative care patients, where there is supportive chemotherapy is given because their immune system has gone so down that no treatment can help them to cure the cancer now. It has spread in their body. So that is called metastase. So at that time, only supportive, some medicines are given, supportive chemotherapy is given to maintain this stage, and whatever comfort or whatever secondary complications like digestive issues and other metabolic problems, we can give supportive treatment only.
All right. Yeah. So I guess that was a very brief and very simple to understand answer for this. So last question to you on a parting ways, if you have to say something to the patients of cancer or caregivers of a person suffering from cancer, what would be that last message from you for them?
See, nowadays, we should avoid this stigma for cancer. First of all, many patients I come across, they still don't tell their family members or friends that they suffered from cancer, or they are suffering from cancer, or they underwent this treatment. Because there is a stigma, still it is there. So we need to educate the patients and even the family members. It is just a health condition, no doubt. It is a major health condition. It is going to affect the health, the full family health, and his psychosocial stage or financial situation. Everything is going to get affected. But what happens is when, because of the stigma, patients or the relatives, friends, they hide this condition, it put extra stress of that unnecessary load, I feel, which is given to the patient also and the family also. So please avoid this stigma for the cancer term. Now, as soon as early as possible, screening and with early detection, we can start early treatment. Though treatment is tiring physically, mentally, patient gets drained, also family gets affected, but it is a teamwork, and we all need to support and help these patients as much as possible, rather than even sympathizing them is not a good way to support. Give them support, give them psychological support, give them motivation, help them in as many ways as you can, rather than sympathizing the family and the patient, because it affects the mental status more. So, and also don't get afraid from physiotherapy or exercise part. Accept this as a treatment part of your cancer journey, and include a physiotherapist as a part of your
I think we have lost her.
physiotherapist improve the quality of life in cancer patients. So they should take physiotherapy
Right.
without any fear.
Right. So that's so true. So there's one more question, and I think I need to take this question. Like, क्या synkinesis के वजह से कोई disease हो सकता है? So Fazia, no, synkinesis एक disease नहीं है और ना ही synkinesis के वजह से कोई disease होता है. ये बहुत ही mechanical problem है, जो habit formation के वजह से होता है. So yeah, that's the answer from my end to you. So yes, guys. Thank you so much for joining. Thank you so much for Deepal for sharing this awareness about cancer rehabilitation. I believe that we need to do this more and more because there are so many people out there who are suffering from cancer now, which can be very well managed if physiotherapy is integrated in the core management of cancer. Thank you so much for doing this session with me. Thank you so much for being part of HealthQ Rehab. Guys, I would also like to tell you that Dr. Dipal Shah is associated with us, associated with HealthQ Rehab in helping cancer patients. So if you want to reach out to her, you can just log into www.healthqrehab.com. I will add the link of our website in the description. We also have an app, HealthQ Rehab app, from there also you can book a consultation with Dr. Dipal Shah, an online consultation, and she practices in Ahmedabad. So if you are watching this video from Ahmedabad and would like to meet her in person, make sure to visit her center. We will be sharing all her details in the description box below. So thank you so much for joining this session. And being part of this discussion. And I hope you found value in this discussion. I thoroughly found this informative. Like, there were so many new things which I learned from you, Dr. Deepal. So looking
Thank
forward
you.
to have more conversations with you.
Sure, sure, sure. Thank you,
Thank you
Dr.
so much.
Meghna.
Yeah. All right.
Thank you. Bye.